like the camera lens, or even with the microscope. So they will have the aperture that can control the amount of light that reach the specimen. Okay, usually the aperture is very small, and thus they will produce a small exit pupil for the observer, and therefore if you have a smaller pupil size, meaning that the amount of light that can reach the retina will also be smaller, because you're only looking at a very tiny area, small field. And so for the little control of accommodation, so it will also trigger the myopic shift as well. This is related to instrument myopia. And in our examination room, there are several things that we can do in order to minimize myopic shift during accommodation. Because as you would expect, if you are in an eye examination room, what we want to know is the distance prescription, and we should try to minimize any myopic shift if possible. And therefore, there are several approach that we use to minimize this. First one is that we will present the target, usually the visual acuity chart at distance. So that's why when you attend the eye examination in a clinic, or even in other optical shops or clinic, you will see that usually they will mount the target at distance. Okay, maybe at 6 meters, so that you can control the accommodation is a little bit better. Some practice they may use a 3 meter, but as you expect for 3 meter, then the accommodations would be about 1 divided by 3 diopter. So it's about 0.3 diopters of myopia. If you mount it at 6 meter, so it would be like 1 divided by 6 meters, so it's less than 0.15 diopter. So it's still better than 3 meter. So if possible, we will try to use a target at distance, usually maybe 10, like a 6 meter. Okay. Second is that we usually will present the high contrast target on the chart. So usually you will be having like a black target printed on the white background. So this is a maximum contrast that we can present to the patient to better control the accommodation. Okay? So this is the second thing that we can do. Third one is, of course, remember the luminance will affect the tonal accommodation, and that's why we should have the room with well illumination. Okay, usually this could be done, as I mentioned before, with a light level of about 300 to 500 lux. So in the photopic condition, I think we try to reduce the amounts of the myopic shift as well. So these are all the things that we can do for controlling the accommodation at distance, so that you will be able to get the distance correction more precisely. Okay. Since we still have time, a little bit time, so maybe I will try to cover maybe a few more slides, because in the coming slides we will talk a little bit about the definition. So maybe I can just spend a few minutes to talk about this, and then next week we can focus more on the calculation. Okay. And then maybe by next week we don't need to spend the whole like 2-hour lectures, and maybe we can have an early break. Okay, back to here. So in this part of my talk, I will try to tell you a little bit about the range of accommodation. Range, that means you can how much you can accommodate, and this related to 2 situations. One is when the accommodation is totally relaxed. Okay, so this is when when you try to determine the distance prescription. So you have to make sure that we don't have any accommodation left. Okay, so when the accommodation is totally relaxed, the point which is conjugate with the retina is regarded as the far point of accommodation. So far point of accommodation, or you can see another terms which is more technical. It's called the punctum remotum. So the abbreviation is PR or MR. They just refer to the same situation. Okay, is equivalent to far point of accommodation when you don't have any accommodation at all. So the other point, the second one, is the point which is conjugate with the retina when you have the maximum amounts of accommodation. So this is known as the near point. So the first one is that you don't have any accommodation, no accommodation for the distant one. And for the near is that you have the maximum amounts of accommodation. So that's why we call this a near points of accommodation. The technical term is called the punctum proximum, PP or MP. So concerning about the range, so the range of course would be the distance from the PR, the punctum remotum, to the PP, the punctum proximum. In terms of the amplitude, it would be the dioptric difference between the PR and the PP. Okay, so let me give you a few examples. So if you can finish this example, so I'm sure you have ideas about what is the difference between the PR and PP. So I think so I hope maybe we can finish this, and then we can for the rest I think we can talk about it in the coming week. So I want you to look at these three examples. The first one is that can you determine the clear vision range for amateur? So amateur, that means no refractive error, with 5 diopters of accommodation amplitudes. Okay, so what I want you to do is that I want you to type in your chat box. Okay, so to tell me the range, okay, of where the patients can see it clear, okay, with patients who have no refractive error at distance and 5 diopters of accommodation. So where would be the PP and PR, or the near point, or the far points of accommodation, and this will determine the range of their clear vision. So so 1, 2, 3, we have 3 examples. So I hope if you can write down the answer. So you can write down question number 1, okay, and then the PP and PR, or you just simply write down the distance, okay, will be sufficient, I think. Yeah, and you can also let me know a little bit whether you understand the things or not. Okay, let me see. Okay. Okay, if you have any questions, you can just type in the chat box. So for the first one, amateur, so 5 diopters of accommodation stimulus. Okay. So where would be the far point? Anyone? Okay, so for the first one, can you let me know where would be the far point for the patient number 1? Yeah, infinity. Okay. Yeah, that's very good, I think. Infinity, because this is okay. For some reason, I can't see the your chat. Let me see. Is it something wrong here? And let me see. Okay. Actually, in fact, it's so for the first patient, yeah, it's amateur. So presumably without any accommodation, so the objects at infinity, if you're talking about the first of all the far point for patient number 1. So this is a patient, the patient number 1, question number 1. Okay, for the far point, I think it should be at infinity. At infinity would be the far point. And what about the near point? So for the near point, then you can see that it's 5 diopters of accommodation stimulus. Okay, so if you write down so 20 centimeter, so would be okay. Yeah, I mean would be right. Okay, so 20 centimeter. So for the range, so that means for patient number 1, from infinity to 20 centimeter,